Good day everyone! Today I'll be going to discuss neuroblastoma, and it includes the definition, the assessment, and the management. So let's move on to the next slide. Neuroblastomas are tumors that arise from the neurochrodermal cells of the sympathetic nervous system. Cells are highly undifferentiated and invasive. It occurs most frequently in the abdomen, near the adrenal glands or spinal ganglia, and are the most common abdominal tumor in childhood. Neuroblastoma occurs primarily in infants and preschooler children. It is slightly more common in males than in females. So let's proceed to the assessment of neuroblastoma, and here are the clinical manifestations. The growing tumor is most often discovered on abdominal palpation as an abdominal mass after general symptoms of weight loss, constipation, and anorexia. Pressure on the adrenal glands from the tumor may cause excessive sweating, flushed face, and hypertension, and abdominal pain and constipation may also be present. Moreover, compression on the spinal nerves or invasion into the intervertebral foramina may cause loss of motor function in lower extremities. If the primary lesion is in the upper chest, children will report dyspnea, swallowing may be difficult, and neck and facial edema may occur from compression on the vena cava. If the liver metastasis is present, children may have jaundice. If metastasis to the skin has occurred, blue or purplish nodules on arms or legs may be seen. Next are the labs or diagnostic tests for neuroblastoma. First is the IMBG. The extent of the tumor and any metastasis present are identified by MIBG, methiodobenzyl guanidine scans. MIBG scans are a nuclear medicine scan that utilizes radiolabeled iodine to identify tissues with norepinephrine transporters in high concentrations like neuroblastoma cells. Up to 90% of neuroblastoma cases are MIBG avid, allowing identification of disease and metastasis by this modality. Next is the MRI. MRI may be utilized to evaluate for the presence of disease. In addition, MRI may be utilized to evaluate for the presence of disease. Imaging of the chest, abdomen, and pelvis is often performed since this is most tumors present. Next are the bone marrow aspiration and biopsy. They are also performed to evaluate for the presence of neuroblastoma. So let's move on to the management for neuroblastoma, and here are the therapeutic management. Infants in the initial stages of disease may require observation only, as some of these tumors will regress without intervention. If the tumor is localized, stage 1 or 2, therapy will consist of surgical removal of the primary tumor. If the tumor is stage 3, lymph nodes are involved, or stage 4 metastasis has occurred, surgery will be followed by chemotherapy combinations using agents such as doxorubicin, cyclophosphamide, etoposide, and carboplatin. Frequently, high-grade and advanced neuroblastomas are also treated with immunotherapy and autologous stem cell transplants. The stem cell transplants in this case are used as a bone marrow rescue, allowing for the delivery of high-dose chemotherapy that would otherwise completely ablate the bone marrow. Tumors that are MIBG avid may be treated with MIBG therapy, administration of radioactive iodine that is readily taken up into the tumor, and provides localized radiation therapy to neoplastic tissues. So that's all for my report. Thank you for listening.